eardrum perforations. You need to be able to distinguish between a safe and unsafe ear. Now, let us be very clear. A safe perforation, as you see here, is one that which is surrounded on all sides by a remnant of tympanic membrane. What is the protection here? When the rim of membrane is surrounded by the tympanic membrane, outer middle epithelium cannot migrate into the middle ear, and therefore it cannot form cholesteatoma. Therefore, this is a safe ear. An unsafe ear is when the perforation is not surrounded on all sides by a remnant of the tympanic membrane and directly it abuts onto the bone. That is, the annulus itself is destroyed. So, outer epithelial canal skin can migrate into the middle ear. That is called skin in the wrong place, and that is called cholesteatoma. The risk of a safe perforation are that they may allow infection to enter the middle ear, and sometimes they have more serious sequelae. So let's have look at various perforations. This is an almost 3/4 perforation, you see, and all around, therefore it is surrounded by a drum remnant. There are tympanosclerotic plaques in the anterosuperior quadrant, in the posterior quadrant, and through the perforation we can see the promontory. Therefore, a safe perforation. Now you see an unsafe perforation where it almost extends to the bony rim. The annulus is not surrounding. The annulus acts as a protective barrier, preventing the migration of outer canal skin into the middle ear. That is the amazing protection that the annulus offers. In the absence of the annulus, the outer canal skin can migrate into the middle ear, skin in the wrong place. That is called cholesteatoma. Here you see, because of negative pressure, the pars flaccida, which is flaccid because it is absent in the middle fibrous layer. Because the middle fibrous layer is absent, it has only the outer squamous epithelium, inner mucous layer, and therefore the moment there is a negative pressure, the pars flaccida will retract and eventually balloon into the middle ear, causing a sac, eventually giving way, debris will accumulate, and that becomes a cholesteatoma. That is a primary acquired cholesteatoma. When there is a perforation in the pars tensum, which is marginal, that's a secondary acquired cholesteatoma. So that's the essential difference between various types of cholesteatoma. You see, it's so very clear. This is an attic cholesteatoma. Now, whenever there is a cholesteatoma, there is no role for cortical mastectomy. If you say cortical mastectomy for an unsafe ear, this is an unsafe ear because it's a life-threatening condition, they can die too. So, if you say cortical mastectomy for an unsafe ear, straight away you will fail. What does this surgery required here is modified radical mastectomy, clearance of the disease, and reconstructing the middle ear hearing mechanism. That is what, of course, all that can be combined into one term today, and that is called flexible otologic surgery. I repeat, what is the eventual surgery for an unsafe ear? Modified radical mastectomy with with clearance of the disease and making a nice cavity which can periodically be inspected and cleaned. Today we are at one stage reconstruct the hearing mechanism and completely seal the middle ear cleft to give the patient a serviceable hearing. That is the essence what we will do. Nowadays we don't give a permanent drainage cavity which can periodically has to be inspected every 3 to 6 months because debris and wax will accumulate in the cavity. Today at one stage after clearing the disease, we will reconstruct the hearing mechanism and seal off the middle ear cleft by a tympanoplasty.